Hi, my name is Ashley, and today we are going to do an assessment of the musculoskeletal system. So this is my patient right here, and I'm going to start by noting the muscle symmetry in his face and neck. You begin by palpating the temporomandibular joint for movement, sound, and tenderness. So I'm going to have you close your mouth and open your mouth and move your mouth side to side. Okay, any clicking noted? No. There is no clicking. Could you protrude your bottom jaw and retract? Okay. There is full range of motion and no clicking noted. I'm then going to palpate the neck and cervical area for any tenderness. Any tenderness?
Nope.
Okay. And I'm going to now check for range of motion. So I'm going to have you tuck your chin and hyperextend and put your ear to your shoulder and the other ear to shoulder and rotate to your right, rotate to your left, and can you push against my hand and then again this way? Okay, there's full range of motion in the neck and +5 strength and no tenderness noted. We're then going to move on to the spine, so I'll have you stand up. And I am noting the spine for alignment, symmetry, and range of motion. So the cervical area is concave, the thoracic area is convex, and the lumbar area is concave, which are all normal findings. I am then going to palpate your spinal process and paravertebral muscles for alignment and tenderness. Any tenderness?
Nope.
Okay. And the shoulders and hips are equal. Can you bend forward and touch your toes? And the spine is straight. And can you hyperextend backwards towards me? Okay. And side to side laterally. And then can you rotate side to side? Alrighty, so there is full range of motion in the spine. I am then going to check for the upper extremities. And
Go.
I'm going to inspect the shoulders for equality in height, the wrists and hands for position, and the number of digits in the fingers or in the hands. So can you, the shoulders are equal in height and your hands are down by your side, and there are 5 digits noted on each hand. I'm then going to palpate your shoulders, elbows, wrists, and hands for firmness, edema, tenderness, and masses. Any tenderness? Okay, great. Okay, so we're gonna do some range of motion of your arms. So could I, or for the shoulders, so could I have you put your arms out? This is flexion and extension and hyperextension. And then can you put your arms out? And that is abduction, and then in, and that is adduction. And can you put your arms behind your back and then behind your head? That is internal and external rotation. And there is full range of motion in the shoulders. I am then going to note the strength in the shoulders. So I'm going to have you push up on my hands. Great, and there is +5 strength in the shoulders. So we're then going to do a test called the phalanx test, and I will have you flex your wrists and like this. I'm sorry. The phalanx test, you flex your wrists like this, and you hold for 1 minute. If the test is positive, if after 1 minute the patient experiences numbness in the thumb, index finger, middle, and lateral half of the finger, this would indicate carpal tunnel syndrome. You can stop. We're then going to do something called the Tinel's test, and this is where I tap over the medial nerve. You can relax your hand. And do you feel any tingling or numbness? If the patient feels any tingling or numbness in those areas said before, then this would also indicate carpal tunnel syndrome. I'm then going to palpate your elbows for tenderness, which you would do bilaterally. Okay, and could you put your arms out with your palm side up? This is supination, and palms down, that is pronation, and there is full range of motion in the elbows. And can you push up and down with your arms out, and push up on my hands, and then flip over and push down. And there's +5 strength in the elbows. We're going to do the same with the wrists. So I will have you put them out and extend up and hyperextend. And can you move the left to the right? Okay, and that is radial and ulnar deviation. And then can you push up on my hands and down on my hands? And there is full range of motion in the wrists and +5 strength. And then you would check the digits for swelling, deformities, or tenderness. None noted. And can you squeeze 2 of my fingers? Great. And that is +5 strength in the hands. I am then going to move on to the lower extremities. So the hips, looking at the hips, they are aligned and symmetrical. Is there any tenderness located in your hips? No. And I am going to have you lift your left leg, or lift your leg and bend it into your chest. And this is flexion of the knee and hip. And then can you put your your leg out to the left and cross it over to the right. Great. And that is abduction and adduction of the knee. And then can you bend your knee and again go out and in. Okay, and that is internal and external rotation of the knee. And if you want to sit, I'm going to check the strength of your knee. So if you could just push up, alrighty. And that is +5 strength in the knee. And then push down on my hand, and that is +5 strength as well. And we're going to finish off with the knees and ankle. Is there any swelling or tenderness?
No.
Okay, and there's also no edema noted in the lower or upper extremities. I'm going to have you flex your ankle in towards you and then out, and then I'm going to have you push down and then push back and turn your feet out and in, and that is inversion and exversion. And the patient has full range of motion in the knee and ankle, and +5 strength in the knees and ankle.